If you're dealing with vaginal dryness, there are a few different strategies that you can use. And over the years, I've had many people tell me that they tried using a vaginal moisturizer, but that it didn't work. And when I ask further questions, I often end up hearing that they tried using it 2 or 3 times and that they didn't find it to be very helpful. Sometimes this is because of the way that it's being used, that it's not being used long enough to see benefit, or that they're using it more like they would use a sexual lubricant than the way that we use vaginal moisturizers. So I'm going to help you contrast what to do with a moisturizer and how to use a lubricant. Sexual lubricants are used only during sexual activities or during daily activities where there may be some friction or discomfort. They are designed to reduce the friction. So you think about putting on a lubricant and things will slide, there will be less friction and less discomfort. It only helps while you have that lubricant on for those several minutes or however long you're using it for that moment. Whereas a vaginal moisturizer is used much more like we use a face cream. So we use that repeatedly, once or twice a day, over the course of many weeks, to keep our tissues healthy and moisturized. Vaginal moisturizers do need to be used several times a week. In the first few weeks, you may even use them daily, and they need to be rubbed into the tissue in order to have that moisturizing benefit. They are available over the counter. There are many different products, including Repagyne, Gynatrope, Zestica, Replens. Any of these are fine. Some are cream-based and administered with an applicator in order to get them inside the vagina. Again, these ones are easy to rub into the external genitals or the vulva. Others are ovule-based, so they're like a small pellet that's placed inside the vagina, and then with the body heat, it does melt over time. If you put this in before bed, you're less likely to have a mess or things dripping out. You're more likely to get the benefit internally, but you do need to rub something into the vulva. If there isn't enough from the product that you're using, you can also use natural products such as coconut oil for a moisturizing benefit. These are used daily or every other day over the course of many weeks before they typically show benefit, in contrast to a lubricant, which is used just when you want to have sex or just when you're engaging in a physical activity that might cause friction or discomfort. You use the lubricant, you place it on the object that's going to be inserted into the vagina, and you place it on the vagina, including the vulva. And then when inserted, you're obviously decreasing friction. You may need to apply it more than once during that encounter. You may also find that a silicone-based lubricant lasts a little bit longer and you need to apply it less often with less volume. You also may find that a water-based lubricant might be a good option, particularly if you have any sensitivities regarding yeast infections or any other kind of vaginal discomfort, or if you're going to be using toys or condoms. Hope this helps to differentiate some of the differences between lubricants and moisturizers.